तस्य भासय सर्वमिदं विभाति.
Everybody, Namaskar. I'm Dr. Mohan Shenoy. I'm a senior consultant endocrinologist and thyroid specialist. I work in Trivandrum. Today we have got the ESI ITS Facebook Live, and we are all joining here on the context of World Thyroid Day, which happens to be tomorrow. So we have got an interesting discussion planned. As you know, we have got a lot of discussions on a very critical issues, how to manage thyroid better to improve the lives of the people around us. That is what the theme says. To join us today's program to discuss 10 commonly asked questions, I welcome today's moderator, who is Dr. M.V. Rama Mohan. He's a senior consultant endocrinologist, and also he's a colleague of mine at the ESI and ITS Executive Committee. He's working at Nellore. Welcome, Dr. Rama Mohan. So today joining us, can you just unmute yourself? Yeah. Welcome, Dr. Rama Mohan.
Yeah, thank you.
So
thank you.
To take the program forward, I welcome each other panelist. The first panelist joining us is Professor Dr. Narendra Kotwal, who is a senior endocrinologist and also ITS president. He is also the past president of ESI. He has got so many textbook chapters as well as publications. He is a very good expert in this field of thyroidology. His key interest includes spiritual endocrinology and environmental endocrinology, besides interest in thyroid and life. So welcome, sir. Namaste, sir. To join next will be Dr. Kaushik Pandit. It's a pleasure to welcome the ESI president. Well, thank you for joining today's program. He's also a very good expert in the field of thyroid and also endocrine science. He's heading the task force on transgender endocrinology, which is also a new branch of endocrine science. So he's joining us from Calcutta. Thank you, sir, for joining for today's program. So to complete the panelist, we have got an expert from Lucknow, who is Dr. Rama Pradhan. Madam is also a colleague of mine at ITS. She's a thyroid endocrine surgeon working at Medanta, Lucknow. She's also an expert in thyroid science, and she has done a lot of thyroid surgeries and spreading awareness in the field of thyroid health and women's health. Welcome, madam. Thank you for joining today. To complete the list, we have got Dr. Ranadhir Mantri. He's a senior nuclear physician and thyroid expert joining us from Hyderabad. Welcome, Dr. Ranadhir. Can you just, thank you. Yeah, thank you for joining. So I just hand over the session, and also to complete, I have not forgotten the main person, Dr. Arun S. Menon, who is the Honorary Secretary of ITS. He's also a senior endocrinologist who's working at Dubai and also at Kochi. He's also joining us today live from this place. So welcome, sir. And I hand over the function over to Dr. Rama Mohan. What have you lined up today, Dr. Rama Mohan?
Yeah, good morning, all. It's indeed a pleasure and happy to be part of thyroid awareness for World Thyroid Day. And our main aim today is to spread awareness among the public about the thyroid disorder, so that if they know more about the disease, their life will be happy in future. So to have today, we have eminent panelists, President ITS, President ESI, and Secretary of ITS, sir. And today we'll be discussing about the common thyroid questions or doubts who faced by our public now. And we'll be doing for next maybe 40 to 50 minutes this Facebook Live. So thank you, Mohan Shenoy, for this opportunity, and I thank ITS and ESI for this opportunity. So we know that thyroid disorders are rampant among the people, and as day passes, there are many quacks and confusions among the people about who are the best people to treat thyroid disorders, and what are the different types of myths about thyroid disorders, where people tend to confuse themselves, sir. So now I'll be having a panel discussion questioning all our panelists to enlighten our public about these disorders. Thank you. And Sir Narendra, sir, good morning. The first question will be yours. What is the thyroid gland? Can you elaborate how it functions in our body, and what is the importance of it in our body?
Thank you, Dr. Ramon, for asking that question. As I can see in your logo, thyroid gland is a butterfly-shaped organ in front of our neck. And what it does, certain hormones are produced, which are called thyroid hormones, which impact metabolism, energy, temperature regulation, and so many functions in the body. Optimal level of thyroid hormone is very important for the metabolism of the body. If levels are high, it creates problem. If levels are low, it creates problem. High level, generally you will find patient losing weight, having increased appetite, sometimes eye prominence, eyes are prominent, and sometimes irregular heartbeat is there. If levels are low, there may be weight gain, lethargy, fatigue, so many other things are there. So for any endocrine disorder, for that matter, optimal levels of hormones are important to have the normal energy levels.
Yes, sir. Thank you so much, sir. Sir, Dr. Kaushik, sir, good afternoon to you. So we know that the word called hypothyroidism, where people find confusion between what is a hypothyroidism and what are the symptoms to look for, and who are the people to look for hypothyroidism, sir?
Well, as Namaskar, as Dr. Kotwal had already said, that there are different types of thyroid disease. Either it is overworking or underworking. Hypothyroidism is the situation where the gland is underworking. The word hypo means low, and ism means the presence of that problem. So it is the low thyroid gland action. And as Dr. Kotwal had said, that it's an essential gland because it secretes essential hormones which is necessary for every cells of the body. And therefore, if the gland is not working properly, there will be deficiency of action seen in almost all organs, which is usually manifested as unusual tiredness. There can be little weight gain and hair fall and dry skin, or for ladies, they can have problems with the periods. So all this in combination can suggest that this is a problem of the thyroid disease, and which can be very easily diagnosed and very easily treated. So it is important that you visit your endocrinologist in case you encounter such symptoms, and therefore it can be diagnosed very easily what type of hypothyroidism it is and how to treat this one. And as Dr. Kotwal has said, optimal level of the hormone is necessary. So you should not be treated either more or less. You should be treated correctly. So visit your endocrinologist when you have got the symptoms of hypothyroidism.
Yeah, thank you, Kaushik, sir. Sir, Arun, sir, namaskar. Sir, what is hyperthyroidism? People tend to confuse, sir, what is hypo, what is hyper. So what is this word called hyperthyroidism, and how if it affects people, sir?
Thank you, Raman. Thanks for that question. Yes, it's not, the hyperthyroidism is not as common as hypothyroidism, what Dr. Pandit was just mentioning about. But hyper is a condition of too much of thyroid hormone. And it can happen due to various reasons, which I'll tell in a minute. But the excess of thyroid hormone in your body can actually produce a lot of symptoms. Some of these are very non-specific. When we say non-specific, you can't identify just based on that symptom. For example, tiredness, okay, hair loss. These are two very common things that we see. But that can happen with low hormone, hypothyroidism, or high hormone, which is hyperthyroidism. So excess of hormone in your body can produce these two symptoms, tiredness and hair loss. But more importantly, there are some specific symptoms that can happen. And what are they? That is, some people present with palpitations, the heart racing, and excess heartbeat. They can feel their own heart racing. That's a very specific symptom of hyperthyroidism. The other common symptom is weight loss. Many people get weight loss. Okay. Then other things like sleeplessness, and then actually when it goes on, anxiety. So there are a number of other symptoms that can happen due to a hyperthyroidism. Again, the only way we can say for sure is when you have actually seen a specialist and the specialist has done a test and he has looked in it. Because it is always very important that we don't self-diagnose these sort of problems, and we have to look at the background of how this has happened before we start to treat, because we see this quite often. That is why I'm taking a bit of time to explain that. We see people with the blood test showing hyperthyroidism, that is excess hormone, and straight away somebody will put them on tablets, which is the anti-thyroid tablets or the neomercazole. The fact of the matter is that There are a lot of patients who don't need these medicines. They have hyperthyroidism, but this is due to a condition called thyroiditis. Thyroiditis is a inflammation. It is a swelling of the gland, which is self-limiting. For that, you may not need these tablets. So it's important that you see a specialist, because you don't want somebody to just start you on some medicines. You need to understand what is the reason for this hyperthyroidism, and that needs further testing. And I'm sure if we get an opportunity, we'll discuss that further. But this is why it is important. Although these are simple conditions and very easy to diagnose, the treatment there can be subtle differences, and it's important that we identify this through a specialist opinion before we start on treatment. Because if you start on the wrong note and start on the wrong treatment, sometimes you end up with long-term treatment which has gone wrong. So very, very important that at the first step itself, you see the right people.
Yeah, definitely, sir. We see most of our hyperthyroid people referred from a cardiologist, neurologist for other like symptoms, as you told, palpitations and weakness and tremors, sir. So thank you, Arun, sir. The next question, Dr. Roma, madam, namaste. So can you elaborate what are the thyroid swellings like goiter, nodules? These are the different terms where people get confused. Can you explain the different, what do you mean by thyroid gland swelling? It may be a goiter, it may be a nodule.
So basically thyroid gland जो होता है we have या तो functioning उसकी ज़्यादा होती है या कम, as already mentioned by our previous speakers, या तो we have a गांठ और swelling in the thyroid gland जो आपके neck के सामने दिखाई देगी आपको. तो that is a structural disorder that of thyroid. Not maybe it is related with hormone or not, but that's a structural problem. अगर कुछ ऐसी गांठ आपके गले के आगे आपको दिख रही है तो first step रहता है you need to consult your either endocrinologist or your endocrine surgeon. So once you have consulted them, they will ask you for a simple ultrasound. I do get patients जो CT scan, MRI सब करवा के आते हैं, but ये एक mention करना है कि ultrasound is a simple test जो फर्स्ट टेस्ट होना चाहिए. सबसे पहले हमारा ब्लड टेस्ट होगा थायराइड का TSH सिंपल सा, और एक अल्ट्रासाउंड. अल्ट्रासाउंड से पता चलेगा कि कैसी टाइप की गांठ है, एंड मेक श्योर कि आप अपने रेडियोलॉजिस्ट से बोले कि उसकी थायराइड ग्रेडिंग बताएं. वो थायराइड नोड्यूल है तो उसका वो ग्रेडिंग बताएं, क्योंकि कई सारे वी सी अल्ट्रासाउंड पिक्चर्स जिसमें उन्होंने बोला इट्स जस्ट अ स्वेलिंग, कोई डिस्क्रिप्शन नहीं होता. सो मेक श्योर यू आस्क योर रेडियोलॉजिस्ट कि वो थायराइड स्कोरिंग बताए. उसके बाद एक टेस्ट होता है फाइन नीडल एस्पिरेशन साइटोलॉजी, जो नीडल टेस्ट होता है जिससे पेशेंट्स काफी डरते हैं. बट आई मस्ट टेल यू वो नीडल जो यूज होती है दैट इज इवन स्मॉलर देन नॉर्मल ब्लड टेस्ट जो आपका विड्रॉ करते हैं, तो उससे भी पतली नीडल होती है, कोई डिस्कम्फर्ट आपको ज्यादा नहीं होगा. बट इट्स इसेंशियल, क्योंकि थायराइड स्कोरिंग के हिसाब से हम लोग डिसाइड करेंगे कि वेदर FNAC होना है कि नहीं होना है. ये 3 बेसिक टेस्ट है जिसको ट्रिपल असेसमेंट बोलते हैं, जो आपके डॉक्टर आपको सजेस्ट करेंगे. डेफिनेटली जब कोई गांठ आपके गले में होती है तो यू आर ऑलवेज स्कैर्ड कि कहीं ये कैंसर तो नहीं है. एक चीज अच्छी है कि मैक्सिमम जो गांठें होती हैं वो साधारण ही होती हैं, जिसको हम लोग घेंगा बोलते हैं या गॉइटर बोलते हैं. तो ऐसी जो उसमें पूरा थायराइड एनलार्ज्ड होता है. अगर वो सिंगल गांठ है तो इसको एक सॉलिटरी नोड्यूल बोलते हैं, जिसको हम टेस्ट कराएंगे, और उसमें बहुत कम चांसेस होते हैं कैंसर होने के. बट हमें कंफर्म करना जरूरी है कि ये गांठ साधारण है या कैंसर है, क्योंकि अगर गांठ साधारण है देन वी कैन फॉलो द गांठ, और अगर कैंसर है तो उसका ऑपरेशन आपके डॉक्टर आपको बताएंगे.
Yeah, thank you, madam. The important point is that we are not supposed to miss FNAC in each nodule so that the risk of cancer can be seen early. So yes, madam, thank you. So Ranadir sir, welcome. Namaste from ITS. It's the first time we are having you, a nuclear physician, on our Facebook Live, sir. Sir, can you explain what is the role of nuclear medicine in thyroid health, and what is this nuclear scan? So we get very much confused. What is radiation? What is this radiation? Like everybody is afraid of this nuclear, sir. Please tell me.
Thank you, sir. Thank you, Dr. Rama Mohan. Any endocrine disorder, the diagnosis of endocrine disorder is by labs, by biochemistry. Nuclear medicine or any imaging plays the role in localization. We localize hyperfunctioning tissue by using a isotope. Nuclear medicine deals with diagnosis and therapy of many conditions using radioisotopes. In this, we inject or we give orally a small dose of radioactive substance which goes and localizes where there is hyperfunctioning tissue. In thyroid toxicosis, as our previous speaker said, there are many symptoms, but when we have a diagnosis of thyroid toxicosis with low TSH, the treatment can be simple reassurance in thyroiditis to complex surgeries. The simple reassurance, if there is no uptake and if there is no uptake on the thyroid scan, the patient can be reassured that there is nothing. There can be otherwise it can be diffuse pathology or a focal pathology. In diffuse pathology, the endocrinologist or the treating physician will give antithyroid drugs. If there is a focal pathology, we treat with radioactive iodine. If there is a non-functioning nodule or a cold nodule where the malignancy is suspected and which cannot be, which ultrasound, as madam said, can be sometimes equivocal, and that time to characterize whether it is non-functioning nodule or functioning nodule, we do a thyroid scan. And in children, we do thyroid scan to find out if there is any ectopic thyroid tissue, if there is no normal functioning thyroid tissue in the normal place. So nuclear medicine, we use isotopes to see where, if it is normally located or abnormally located, if it is excess functioning throughout the tissue or it's a focal excess functioning or non-excessive function, maybe due to drugs like amiodarone or anything can cause thyroid increased thyroid hormone levels and or thyroiditis. And then in malignancies, we not only confirm the completeness of surgery, also we also treat if there is any tissue left or if the tissue has metastasized.
Yeah, thank you so much for enlightening, sir. Sir Kotwal, sir, I'm back to you. So there are so much of confusion about the hypothyroid patient taking tablets, when to take, what is the timing, and also about the diet patterns they should follow. Can you elaborate these to the public, sir?
थैंक यू डॉक्टर मोहन. हाइपोथायराइड पेशेंट्स का ट्रीटमेंट पार्ट के लिए क्या, फर्स्टली इसका जो हार्मोन कम है, जैसे कि डॉक्टर कौशिक ने बताया हार्मोन कम है, हार्मोन हैज टू बी रिप्लेस. तो इसमें जो टेबलेट होती है वो थायरॉक्सिन टेबलेट या थायराइड हार्मोन व्हाट एवर टेबलेट है, इसका इट्स वेरी इंपॉर्टेंट कि ये सुबह एम्प्टी स्टमक लेना है, आपको सुबह खाली पेट लेना है. एंड उसके लेने के पश्चात कम से कम 30 मिनट्स या 1 आवर तक आपको कुछ नहीं लेना है. लेकिन फैक्ट रिमेन्स कि हमारे देयर आर लॉट ऑफ यंग पीपल हु आर डूइंग नाइट शिफ्ट्स आल्सो, रात को भी काम कर रहे हैं, वो सुबह उठ नहीं सकते हैं, तो ये शाम को भी आप ले सकते हैं, लेकिन टेबलेट लेने में और उसके पहले कम से कम 3-4 घंटे में आपको कुछ खाना नहीं है. सो दैट इज वेरी इंपॉर्टेंट बिकॉज कि ड्रग की जो एब्जॉर्प्शन है वो उसके लिए एसिड चाहिए और एम्प्टी स्टमक में होती है. एज फार एज डाइट्स, जैसे कि आपने बोला है कि देर आर सर्टन डाइट्स वी फाइंड इन लॉट ऑफ मीडिया की ये नहीं खाना वो नहीं खाना ना, ऑल दोज थिंग्स, देर आर सर्टन डाइट्स जिनको गाइट्रोजन्स बोलते हैं, लेकिन वो चीजें लेने के लिए आपको आधा किलो या किलो खानी पड़ेगी जो कि कोई नहीं खाता है. सो आई विल सजेस्ट कि जितने भी लोग ये देख रहे हैं हमारा ये सेशन, कि अगर आप मेडिसिन ले रहे हैं तो उन सब चीजों को सेवन करने में देयर इज नो प्रॉब्लम. यू कैन टेक ऑल दोज थिंग्स प्रोवाइडेड यू आर टेकिंग योर मेडिसिन रेगुलरली. लेकिन जिन लोगों को रिस्क है और दवाई नहीं ले रहे हैं तो उन चीजों का सेवन थोड़ा कम करना चाहिए, जैसे कि टर्निप हो जाता है, कॉलीफ्लावर हो जाता है, वो चीजें. बट इफ समबडी इज ऑन ट्रीटमेंट, नथिंग इज रिक्वायर्ड, यू कैन टेक एवरीथिंग.
Thank you so much, sir. Sir, Arun sir, I have a question for you. There is so much confusion among the public, including social media, about alternative medicine use of Ayurvedic homeo drugs for hypothyroidism, thinking that there is a permanent cure for these diseases. And so many people tend to ask me whether my thyroid will go away or not. Sir, I don't want to use this tablet for lifetime. Can you elaborate the role of these alternative medicines in hypothyroidism? Do the patient should fall for them or not, sir?
Yeah, I think it's a very important question, Rama, because yes, the social media does sometimes mislead in this regard. I think we have to look at evidence when we speak about any scientific explanation we give. So I think what I wouldn't want to name an alternative system and say, okay, this doesn't have or this has. What we should do is the public should understand the basic problem that is happening in this issue. So you're taking the case of hypothyroidism. So what is happening in hypothyroidism? The thyroid gland is getting damaged. Okay, there is a damage of the thyroid gland, and this is happening due to most common reason being an immune system problem. So your own immune system, we call it as an autoimmune condition. So your own immune system is triggered by perhaps extrinsic factors, which could be an infection, which could be, I think we are also going to discuss about endocrine disruptors later and all that. So chemicals and many other things. So the fact of the matter is your immune system is being triggered by some extrinsic factor. And when your immune system acts on your thyroid gland or attacks your thyroid gland, unfortunately, when your thyroid gland gets damaged beyond a certain extent, so far in medicine or in any branch of medicine, we haven't found a way to fix this damage and cure the condition. So because if the condition has to be cured, your gland has to be brought back from a damaged gland to a normal gland, isn't it? Unfortunately, in no branch of medicine, we have found a way to completely normalize this gland. So what can we do? All we can do then is to replace the hormone that is lacking because the gland is unable to produce it. This is exactly the principle behind the treatment. So it doesn't really depend on which branch or anything. As long as you understand the basics of what is happening in hypothyroidism, then you know what you can do. So far, nobody has found a way to fix that damaged gland and make the gland normal so that it can start to produce a hormone by itself. If the gland is not producing the hormone by itself, all we can do is to replace what is deficient. This is exactly what we are doing. Now, the other thing is people, naturally, nobody, I mean, including me, I wouldn't like to have medicines for the rest of my life. If somebody says, oh, you should take medicine, we wouldn't want to. Yes. Why are we having to do this? Because there are many reasons behind this. One is, this is the only option we have at this point. Okay, number one. Replacing it properly is the only option we have. The second thing is, this medicine has been proven for decades now. I mean, we have had this for 70, 80 years or even longer. There are children who are born without thyroid gland, okay? And they have gone into 80s, 70s, 80s of age without any problem, which means this drug is extremely safe. So this is one of those drugs that we know of the synthetic versions, which we can almost definitely, almost 100% say it is safe, without any kind of harms. So I think that is very important. So the fact that we have a very, very safe option, which is replacing the problem. And the third is that if you replace it properly, I mean, not taking whenever you feel like, or it is very simple to replace that. Kotwalji did tell us how to take it earlier. But if you replace it properly, if you do the right kind of monitoring every 3 months or 6 months or whatever your doctor advises, if you do it properly, almost all the symptoms that could be attributed to hypothyroidism can be cured. Yes, there are still some problems. There are still some limitations of treatment. But that again you need to discuss, because it may not all be due to thyroid problem. Because people always say, oh, I'm gaining weight. It's not, I mean, you have given me thyroid, this thing, but I'm still gaining weight. I mean, we know weight gain is not just due to thyroid problem. There are so many other reasons for that, and I'm not going to go into it. But clearly, there could be other reasons for your symptoms. So don't always blame thyroid for all the symptoms you are having. Make sure that your thyroid is perfectly managed by yourself with the help of your specialist. And then if you have further symptoms, please go ahead and discuss that with the doctor to see what can be done about it.
Yeah,
thank you.
Thank you so much, Arun sir. Sir, Kaushik sir, welcome back. And I have two questions for you. So, do kids or children get thyroid disorders? Do we need to screen every newborn baby for thyroid problem? And the second question is about pregnancy and thyroid, hypothyroid, how they are related, sir. Can you explain for our public, sir?
The first question is, do kids get thyroid problems? Well, thyroid problems can happen at any age, from birth to a very late age. Second is, some, as Dr. Menon during his talk has said, that this hypothyroidism is because of the gland is not functioning. In some people who are born with a disease where there is no thyroid gland at all. So obviously there will be gross hypothyroidism when they are born. And this is technically what is known as neonatal hypothyroidism or congenital hypothyroidism. This congenital hypothyroidism is a dangerous disease because, first of all, thyroid gland is an essential gland. So a baby will have serious problem, especially the development of his or her brain. So for the development of his or her brain, the thyroid hormones are essential. And in case the thyroid gland is not functioning normally or not there, so leading to a state of very low thyroid hormone state will hamper the psychological and the mental and the neurological problem of the child. And for that, one needs to start treatment at the very beginning. So though it is not very common, it is true that many kids are born with hypothyroidism. And for the sake of that, we'll have to test every kid for the presence of hypothyroidism. Because not only for the development of the person who is having a problem, we must remember treatment of hypothyroidism is very easy, very cheap. So it will be a sort of crime if we cannot diagnose hypothyroidism at time of the birth and treat, because unless we do it at the very first 1 or 2 or 3 months, the baby will be having a problem, a neurological problem, a psychological problem, a developmental problem throughout his or her life. So that becomes a big familial and social problem to deal with. And this can be diagnosed and treated very easily. So we should be aware about of the situation of congenital hypothyroidism and try to prevent 100% of it in the society. The second question is pregnancy and hypothyroidism. Well, as everybody had said that hypothyroidism is a common disease, so it is possible that a lady is having hypothyroidism and become pregnant. Though it is known that people who have got significant degree of hypothyroidism, their pregnancy may not occur commonly. But it is very much possible that a lady who had some degree of hypothyroidism, a low degree of hypothyroidism, becomes pregnant. Now, it is important to remember for the development of the fetus or the baby inside the womb, thyroid hormone is essential. For the first, approximately for the first 8 weeks, that means 2 months of the pregnancy, the baby's thyroid is not there. It is the mother's thyroid which supplies the thyroid hormone to the developing baby. So in case the mother is having a thyroid disease, the baby will also have a developmental problem. And as I have said, that diagnosing hypothyroidism is very easy and very easy to treat as well. So we must not lose the opportunity of diagnosing hypothyroidism in the early part of pregnancy and treating it adequately so that the developing fetus or the developing baby inside the womb would not have any problem. And it is also known that hypothyroidism can develop during the early part of the later part of the pregnancy. It can be diagnosed very easily and can be treated very easily as well.
Yeah. So thank you so much, Kaushik sir, for enlightening us. Roma madam, welcome back. Now my question to you is that so many patients who coming with goiter saying that, sir, I have a goiter, do I need surgery? So many patients come with hypothyroid patients also, sir, I have thyroid, do I need surgery? So they are afraid of the term surgery. So can you elaborate who are the guys who need surgery in thyroid disorders, and so what is the people should know about surgery and thyroid?
Yes. So thyroid surgery, of course, anybody would imagine it is scary. It's right in the neck. सब कहते हैं neck की surgery कर रहे हैं तो डर लगेगा, आवाज चली जाएगी, हम बोल पाएंगे कि नहीं, हम खाना खा पाएंगे कि नहीं. But I must tell you कि thyroid surgery is now one of the safest surgery that we perform. And हर thyroid goiter का surgery इलाज नहीं होता है. और बट अगर थायराइड कैंसर आता है किसी गांठ में तो डेफिनेटली वी ऑप्ट फॉर सर्जरी फॉर द पेशेंट्स एंड सब पेशेंट्स को मैं ये बोलना चाहूँगी कि जो थायराइड सर्जरी है बहुत ही सेफ सर्जरी है और इसमें स्पेशली जो वॉइस नर्व होता है उसको बचाना बहुत ज़रूरी होता है। उसके लिए स्पेशल इक्विपमेंट्स होते हैं। पहले तो थर्ड सर्जन्स का कॉम्पिटेंस होता है एंड देन उसमें इक्विपमेंट्स लाइक न्यूरो मॉनिटरिंग वी यूज जिसमें आप नर्व रिकग्नाइज कर सकते हैं। नेक्स्ट कॉम्प्लिकेशन तो थायराइड सर्जरी का मेन होता है वो पैराथायरॉइड्स का होता है, डैमेज ऑफ पैराथायरॉइड ग्लैंड जिसकी वजह से हाइपोकैल्सीमिया मतलब कैल्शियम कम होता है आपका पीटीएच की वजह से। तो वो एक dreaded complication है। आई एम श्योर our endocrinologists are treating with those that problem. So that's one of the genuine problem. So अगर सेफ थायराइड सर्जरी हो रही है, अगर एक्सपीरियंस थायराइड सर्जन से आप सर्जरी करा रहे हैं तो we see each and every parathyroid and preserve them like it is the last parathyroid left in the body. तो उसके लिए भी हमारे पास नए इक्विपमेंट्स है, नई टेक्नोलॉजी है जिसको ऑटोफ्लोरोसेंस बोलते हैं, जिससे हम पैराथायराइड रिकग्नाइज करते हैं एंड वी कैन सेव इट नाइसली। थायराइड सर्जरी की जो सबसे मैक्सिमम प्रॉब्लम पेशेंट्स को आती है कि गले के आगे निशान आना। नोबडी वांट्स अ स्कार इन फ्रंट ऑफ द नेक, एवरीबडी लाइक। तो उसके लिए हमारे लिए है रोबोटिक सर्जरी जिसमें गले के आगे आपके निशान नहीं आता एंड इट्स प्रिटी सेफ। रोबोटिक सर्जरी इज प्रिटी सेफ। उससे आप आराम से थायराइड ग्लैंड निकाल सकते हैं बिना किसी निशान के। तो ये सारे क्वेश्चंस पेशेंट्स के मन में रहते हैं जो मैं पेशेंट्स को बोलती हूँ स्पेशली ओपीडी में कि जिस दिन हम ऑपरेशन करेंगे उसी दिन से आप खाना पीना खा सकते हैं, आप बोल सकते हैं, आप चल सकते हैं। तो पेशेंट्स को थोड़ा ठीक लगता है कि हाँ हम सेम, क्योंकि उनको लगता है गले का ऑपरेशन है कहीं ऐसा तो नहीं हम बोल नहीं पाएंगे। तो ये एक कॉमन मिथ है जो हमें चेंज करनी है एंड बट यू जस्ट नीड टू फाइंड अ गुड एंडोक्राइन सर्जन फॉर थायराइड सर्जरी।
Yeah, nice, madam. Rama, madam. Sir, Ranadhir, sir, I have a question for you. So many patients say that with hyperthyroidism, say that we have bulging of eyes and so eye disease. Can you elaborate something about what is this thyroid eye disease and what care should be taken by patients?
Thyroid eye disease is associated with Graves' disease most commonly, but it may be associated with other Hashimoto's thyroiditis also. The orbital fibroblast express TSH receptors. That is why these people, those who have thyroid stimulating immunoglobulins, the cancer associated orbital fibroblasts are activated. That will lead to many symptoms, mainly redness, difficulty in movement, and sometimes dryness, and sometimes proptosis. That is both eyes move anteriorly, so they will have a lot of prominence of eyes. Most people from villages come with proptosis as the first sign in thyroid problems, and then this is aggravated by smoking and prolonged hypothyroidism, and radioiodine, which we treat for thyroid excessive functioning thyroid, may slightly exacerbate exophthalmos. That's why we have a scoring system. If the clinical activity score, if the scoring system is less only, we give radioiodine. If the scoring system is high, if the score is high, then we will not give radioiodine. Most of the exophthalmos can be managed conservatively, but sometimes if it is excessive, then radiation and other things have to be given. So very rarely we have that excess conditions. Most of them, if it will be limited on. Thank you.
Thank you, sir. Sir, Narendra Kotwal, sir, welcome back. I have two interesting questions for you. Say, I got a 20-year-old female coming with hypothyroidism on tablets saying that, sir, I am not unable to get married. There is a social stigma of hypothyroidism. The groom coming to me saying that you have a hypothyroidism, and can you explain me what is the stigma around hypothyroidism and women marriage, having a marriage and having a future kids? The second question is about diabetes and hypothyroidism.
Regarding आपका जो फर्स्ट क्वेश्चन है स्टिग्मा ऑफ हाइपोथायराइडिज्म, जैसे कि पहले भी डॉक्टर अरुण ने बताया, हाइपोथायराइडिज्म में, या डॉक्टर कौशिक पांडे ने बताया, हाइपोथायराइडिज्म में ग्लैंड कम कर रहा है और कम हार्मोन आ रहा है. सो हार्मोन हैज टू बी रिप्लेस्ड, एंड वंस वी रिप्लेस द हार्मोन्स विद द ऑप्टिमल मेडिकेशन एंड आपका TSH नॉर्मल है, एज फार एज द फर्टिलिटी इज कंसर्न, देयर इज नो प्रॉब्लम. provided TSH remains normal within the range. तो उसको जो ग्रूम का है उसको बताना पड़ेगा कि it is not going to affect the fertility. But in a lighter vein, if such a groom, she should not get married to that groom if he's putting that condition. But medically, there is no problem. She will have normal fertility. As far as diabetes and hypothyroidism is concerned, now there is enough evidence is there कि पेशेंट जिनको डायबिटीज है उनको हाइपोथायराइडिज्म भी ज्यादा है और जिनको हाइपोथायराइडिज्म है उनको डायबिटीज भी बढ़ जाता है बिकॉज जो थायराइड हार्मोन है एज आई टोल्ड यू इट अफेक्ट्स द मेटाबॉलिज्म ऑफ द होल बॉडी सो इट इंटरफेयर्स विद द इंसुलिन के जो एक्शन है इंसुलिन सिक्रीशन है प्लस हाइपोथायराइडिज्म में वेट भी बढ़ जाता है लिपिड एबनॉर्मलिटी बढ़ जाता है सो देयर इज अ लॉट ऑफ क्रॉस टॉक बिटवीन इंसुलिन एक्सिस एंड थायराइड हार्मोन सो जिन लोगों को थायराइड प्रॉब्लम है उनको डायबिटीज भी हो सकती है जिनको डायबिटीज है उनको थायराइड भी हो सकता है तो माय सजेशन टू ऑल दीज पेशेंट्स हु हैव सच प्रॉब्लम्स टू गेट देयर ब्लड शुगर आल्सो टेस्टेड एंड टू गेट देयर थायराइड आल्सो टेस्टेड
Thank you, sir. Kaushik sir, there is so much confusion in the public about the pollution, the toxins, endocrine disruptors, and the thyroid health or hormone health. Can you elaborate your views on what are the relation between these and what are these chemicals disrupting our hormone system?
Well, Dr. Menon, while he was talking about hypothyroidism, he said that thyroid gland gets damaged or destroyed because of autoimmune phenomena, autoimmune problem. The body has got its own problem. But it is also true that somebody who is not having the autoimmunity, the thyroid gland can get damaged because of some extraneous factors. And those extraneous factors come from the environment. What environment? This can be pollutants that are present in the water or in the air. It can be plastics or the commonly that what we use in processed foods or say the fertilizers that we use, the pesticides that we use have gotten chemicals which are small in size and gets inside the body and damages various organs including hormonal organs, the endocrine organs. And that is why they are known as endocrine disrupting chemicals or EDC in short. So these EDCs are present everywhere, mostly in the plastics and the pollutants, air pollutants. And that damages the thyroid gland because thyroid is the concern that we are talking about today. That damages the thyroid gland to the extent that it does not allow the thyroid to function normally and allow the normal amount of hormone to be secreted. And therefore, they suffer from hypothyroidism, and which can be diagnosed and treated. But more importantly, it is important to let everybody understand, including the policymakers, that it is important to reduce the EDCs in our country so that people can maintain a normal endocrine status in their body and normal all organs, not only the endocrine organs, the other organs are also damaged. So therefore, we should all be aware about EDCs and try avoiding those EDCs in the form of plastics and pesticides and pollutants.
Yeah, thank you, Kaushik sir. So now I'm coming to closing remarks. We had 40 minutes of useful discussion for our public about thyroid disorders. And Roma madam, your final takeaway for our public about thyroid surgery and thyroid disorders.
So going with the current trend of Cockroach Janata Party, I would say it's the Thyroid Janata Party, and you need to, the people need to know about it. It is for the gland, for the people, by the gland, and definitely everybody needs to know about their thyroid health. अवेयरनेस फैलाना बहुत ज़रूरी है. अगर हमें कोई प्रॉब्लम है तो मिथ्स हमें नहीं बढ़ानी है. यूट्यूब का आजकल इतना चल रहा है कि पीपल आर कमिंग विद सो मेनी क्वेश्चंस. So we do not have to propagate wrong things. Get your facts corrected, check by your doctor, only then spread your information. Thank you.
Ranadir sir, your closing remarks about nuclear medicine and thyroid disorders.
Like we have cockroaches, we have heat. So there is treatment for thyroid disorders. Most of the thyroid disorders can be treated. It is a curable diseases, either hypo or hyper or malignancy of thyroid. Most of them are curable. be confident and approach your consultant, and thyroid disorders are treatable. Thank you.
Kaushik sir, respected President, Endocrine Society of India. Sir, your closing remarks on thyroid disorders and public awareness.
I would urge everybody to understand that thyroid disorder is very, very, very common. In fact, it is the commonest endocrine abnormality of human being. And it is so common that it can manifest in very many ways, and many times it is not diagnosed properly simply because of the very common manifestations. So we should try to diagnose early so that we can treat early and get a better results for everybody, especially the younger ladies who develop the disease more commonly than the other part of the population. They should be aware that this is a very common disorder which can be diagnosed easily and treated easily without having any sort of side effects.
Yeah, thank you, sir. Sir, Narendra Kotwal, sir, respected President, ITS. Sir, we had a great discussion about all the awareness points. Sir, your take-home message to our public, sir.
Thank you, Dr. Rama Mohan. जैसे कि all panelists ने बताया, thyroid disorder is one of the commonest endocrine disorders, yet remains under-recognized. You will be surprised to know there are 42 million thyroid patients in India. And every 10th adult has a thyroid hypothyroidism, or subclinical hypothyroidism भी 8 to 9% है. Spectrum of thyroid disorder has changed from subclinical to frank hypothyroidism, from thyroid nodule to thyroid cancer. So it is very important to create awareness about the thyroid disorder, जैसे कि today's program is there. As a responsible society, we are trying to create awareness, supporting scientific evidence, clinical practices, and educational awareness with the patients. और हमारे सब पैनलिस्ट ने बताया है कि whenever there is a subtle problem है, आप अपना टेस्ट करवाइए and जो भी concerned specialist उनके पास जाइए, because treatment is easy. और कोई भी अगर कोई कैंसर भी है तो thyroid cancer is one of those cancer where treatment is good and survival benefits are there. So मैं तो यही चाहूंगा कि सारे जनता को जो भी हमारा ये एक प्रोग्राम देख रहे हैं कि अपना थायराइड टेस्ट करवाइए और कंसर्न स्पेशलिस्ट को जाकर उनको रिपोर्ट करिएगा.
Yeah, thank you so much, President, sir. And I would like to thank all the panelists for a wonderful discussion. And I would like to remind all our public that when you have an idea of thyroid problem in your brain, you should immediately consult the super specialist named endocrinologist. So you should remember always that the endocrinologist is the first or foremost doctor who is treating your thyroid problems in a comprehensive way. So thank you everybody for this opportunity, and I give back the mic to Mr. Mohan Shanai.
Thank you. It was a very interesting discussion, very lively as well. मेरे पास जो एक advice है, you also have to come back to our ITS pages and YouTube channels, and please write to our Instagram and other accounts, because we are also having good followers, and you can try to help us get more and more programs, because this was a program which we conceptualized because many questions people wrote to us. So मेरे पास एक final concluding remark है. So there is an English initially civil movement called We Shall Overcome. So now we have got so many misconceptions we should overcome. The Hindi adaptation है हम होंगे कामयाब. So it's a collective struggle. It's a philosophical battle also. Endocrinologists are scientists, like we are all working with a research background. So हमारे पास जो भी spiritual strength है, what all research background है, I think the quacks or the alternative medicines will definitely be defeated. But we don't want you to get misguided. That's why we are doing these programs. So we will overcome. Man mein hai pura vishwas. We'll definitely have a control about a disease. Don't think about whether you can get rid of tablets or whether the scar is big. But the main thing, disease is actually overcome. So thank you for all joining today, and we'll hope that we have more and more discussions like this. And thank you all for, I think, starting from Dr. Kotwal, Dr. Pandit, Dr. Rama Pradhan, Dr. Arunes Menon, Dr. Mantriji, and finally our own Dr. Rama Mohan, and also the team video for having curated this wonderful program, which is a collaboration of ITS and Endocrinology of India. So looking forward to more programs like